many cases of drop foot are permanent, and is there anything that can be done about this?
The question is about having a foot drop, and I'm going to assume it's after a hip replacement surgery. Well, it could really be after hip or knee replacement surgery. And specifically, the question was about treatments for that complication, as well as whether or not it's permanent. There are cases, for those who don't know, a drop foot is when a patient is unable to, medical term would be dorsiflex the ankle, which would mean bringing the toes and foot up towards, in the direction of the head. And this can occur after surgeries. Usually it's the result of there being some type of injury to a nerve. It could be a direct traumatic injury to a nerve, which is really rare, or it can be more of a stretch injury to the nerve, which means that during the surgery, sometimes part of the normal correction of the patient's deformity, the nerve was stretched. For example, if a patient has a really short leg because of hip arthritis, when you put the leg back to its normal spot, you may stretch out some of the nerves, as well as when you do a knee replacement, if someone has a really crooked leg, by straightening that knee out, which is a normal goal of surgery, everything gets a little bit stretched. There's no real definition as to how much stretch is okay and how much isn't. And so unfortunately, sometimes, patients will have a drop foot. It's extremely rare, probably less than 1% as far as a complication rate. There are cases where it is temporary, and there are cases where it's permanent. If it is permanent, there may be other treatments that are available. If after giving the nerve plenty of time to recover, it doesn't. Sometimes we use braces. Sometimes there's even some surgical procedures that can be done to improve the function in those patients.